to practice the software. So I hope it was not a major blunder because most of the time it says that it's disconnected from the network. I don't know why, but let's hope it works. Yeah, we are live. Most of the time it says that it's disconnected from the network. I don't know why. Yeah, we are live.
Are we having an echo effect?
Yeah, that's probably because the Facebook is also, maybe for Tanmay it's not on mute.
No, I don't have Facebook open. The thing is, when we do the Facebook live, there is always a lag between the Zoom and the Facebook. So you have to switch off the mic or the speakers for either the Zoom or the Facebook. I will say switch off the mic, the speakers for the Facebook. Otherwise, you will keep hearing. No, I don't have Facebook open.
Tanmay, the stage is all yours. We start with the 5-year celebration.
When we do the Facebook live, there is always a lag between the Zoom and the Facebook. Switch off the mic or the speakers for either the Zoom or the Facebook. Switch off the mic, the speakers for the Facebook. Otherwise, you will keep hearing. Hi everyone. The stage is all yours. Mayur, can you allow me to share the screen?
Okay, Arundhati is not able to log in.
Hi everyone. We are today updating the whole community about the 2 or 3 major newsletters that we are working with. So I will talk briefly about the biweekly newsletter. How we have thought is I will talk about a bit of the history, how we started with the newsletter, and Himanshi will talk about the present status and what our future plans are with the biweekly. So the biweekly started about 3.5 years back when Somdatta and Avinav were leading the team. But over the time, it has also evolved both in its content and in the collaborations and the sections that it has focused or they've tried to develop. This used to be the initial team and the past and the present team actually of the biweekly. So it started with Somdatta, Avinav, Ritu, Rituparna, Nisha, Aditi, Kashyap, and there were also a lot of interns who came in and during our internship programs. So how the system or the structure of the biweekly was, there was a core team with people who had initially started the platform, and there was always some internships. So in this picture, we have both the core team and the people who came in as intern and eventually also became part of the core team and has become leaders of different other platforms also. For example, Nisha now leads the MedNess platform. I also came in as an intern for the same. Initially, there was a team lead who would work with one intern. So we used to have 4 teams of 2. One was a team lead and one was a intern. Typically, internships were offered for a 6-month period in which people will come and contribute to the newsletter and have a feel of how to collect the stories and how to work with the software and how to basically try to figure out how to publish stuff in a newsletter fashion. we tried several different collaborations, and also we had developed some of our independent sections. In terms of collaborations, I think the major collaborations that we had done in the past, so the newsletter actually started as a mouthpiece for several of the other platforms for STEMPeers. So for example, the Club Sci was one of our major area of focus. We usually used to highlight all the stories and the articles that came up in Club Sci. We used to also cover Onco This Week, which was covered by Richa, and Esha used to cover the MedNess Plus. So these were platforms which basically started being featured also through the Biweekly. And in time, they became independent, and they also started forming the MedNess, which is a huge success in itself. But we used to collaborate with them. We also collaborated with the STEM Times, where we published collages of the publications that they were doing over that week. So these were some of our collaborations in the past. But then we also decided that we should also have some sections which are completely independent of the other platforms and which highlights what we are doing in the newsletter team. Of the top of the list, the success stories were much appreciated. This was talking about people who had transitions from academia to industry, and we did a lot of the success stories in the past. We did the Chris part was also born from the newsletter, which was a science illustration platform between me and Prabuddha. There was a section with Expert Speaks, which was interviews by people who are running a startup or who are doing something extraordinary in their respective fields. We also had the picture of the week section, where people used to submit a non-scientific picture, and we used to feature them. There was a book club, which I have not mentioned here, but this was also one of the collaborations or the sections that we developed through the newsletter. When we started the newsletter, we started with around 100 subscribers, and over time we have close to 800 subscribers in our newsletter team, and we are supported by the Nanotag, Bensai, and the Chen Immigrations as to fund our newsletter. So this is in short, the history of how the newsletter over the time has developed. And maybe Himanshi can update a bit about the current and the future plans for the newsletter.
So I'll also share my screen. Hi, so I'm Himanshi, and I joined the newsletter team early 2019, and this year I'm leading it as the managing editor for the team. So this is our current design. We have two teams, one led by Tanmay and the other one is led by me. Tanmay's team has Nivedita and Kanika, and Shalini and Manish, they are in my team. We have bi-weekly issues that we come up with every 2 weeks, and each team is in charge of one issue after every 2 weeks. So the format this year is a bit different from last year. We have a bunch of new sections. One of the main is that we have original content by our interns. Previously, we used to report on whatever findings they were already in the news. But the interns this year, they are contributing much more in terms of original content. We also have a note from the editor, which is like a summary by the editor for that particular issue, and the editor basically summarizes what the issue is going to be about. Then we have highlights of the week. Highlights of the week is mainly what has happened in the last 2 weeks. Lately, most of the highlights have been related to COVID-19, the various vaccines and the drug trials that are going on, and other immigration-related issues that are prevalent these days. Then is the editor's choice, which is mainly contributed by Saurabh's team. We also have added a webinar watch, because these days there's a lot of webinars and it has become a bit difficult for all of us to keep track of the webinars. So the webinar watch, it helps us, our readers, to keep a track of the different webinars that are going to happen in the next 2 weeks. And the last new section is the day in the life, which is like a success story of all the established people in a particular field, and they share their experiences with us. This is taken care of by Tanmay. And we have, this is, I think, one of the most popular sections currently in the newsletter. Our workflow is also much more revised this year. We have like rotating duties. So when one team is in charge of the main content, then the other team handles the remaining sections, mainly the webinar watch and the job section. But there are a few sections that are constant, like Tanmay, who is in charge of day in the life, and I take care of highlights of the week. So in this year, we have tried to retain some of the old of the newsletter essence and added something new. The old being that we have members from diverse backgrounds that are spread across all time zones. But the new aspects are like we have enhanced focus on teamwork because the entire team is involved in every issue. So that helps us as a better learning experience for all of us. And it also trains us and our team members to lead in the future. We are constantly in touch, mainly by our WhatsApp group. And that brings out the best in our team because we are constantly in communication with each other. And most of the topics that we are currently pursuing are of current relevance, mainly related to the pandemic and how life has changed and how we can use this time to bettering ourselves. So this helps us in staying us and also our readers to stay abreast with the current news. And also it increases our visibility that will ultimately help us in increasing readership. So the road ahead here is that we have 2 new sections planned that were suggested by our interns. One very interesting section is the caption this section, where we can maybe post an image or a picture or an advice and ask our readers to submit their answers. And maybe we can publish them in our next issue of the newsletter so that the readers can see their names and people get excited about that. And another one section that we were thinking of was the inspirational stories, where we can publish inspirational stories by people in STEM or maybe without STEM that are not in STEM. So one of the topics that I was thinking of maybe the mothers in STEM theme. There are many mothers who are facing a difficult time in the pandemic, and one of the stories we can take up from that. So this is what I have. From this, I would like to move on to our interns and if they have something to say.
I can start off. So hi, everyone. I'm Nivedita. I'm a current intern with the newsletter, and it's been a wonderful experience so far. I want to say initially when we all came, how Himanshi mentioned, we're all across different time zones. I've worked with different groups in the past, and I was wondering how it would work with 6 of us across different time zones. And, publishing a newsletter every 2 weeks is no small feat. And I want to say I'm just amazed by the professionalism and the good teamwork and collaborative nature of our group. I really like working with everybody, and everything Himanshi and Tanmay mentioned about constant communication. And it's just a good supportive environment. It's one thing to do an internship for your own professional gain, but I really enjoy everything I'm doing. I feel it's made me, I look forward to writing every time. I keep wondering, okay, when is it our turn? What are we going to write? And it's been wonderful. And Tanmay, Himanshi have been really supportive, and the team as a whole, Kanika, Shalini, Manish, I couldn't have picked better people to work with. So I'm really grateful to all of you, and thank you for making me a part of this journey.
Yeah, so I would continue further. So I'm Kanika, and I'm currently a postdoc at Fraunhofer Institute in Frankfurt. So for me, after finishing my PhD and moving here to Germany, I was looking something, apart from my day-to-day bench experiments or something different from writing manuscripts. That was my biggest thought, I think, to apply for this internship position. And definitely I'm very grateful to Tanmay and Himanshi for giving us this opportunity to work in a collaborative team along with Nivedita, Shalini, and Manish. This has been a really fruitful experience because I belong to pharmaceutical sciences, not really a person belonging to molecular biology or a cancer, background. So for me, it was an experience to move along the breadth of science through these kind of stories, which we are doing like almost bi-weekly. And definitely it has brought that confidence in me, to write something which is not in my domain. And I would coin the term definitely a sort of science journalism. I don't know whether that's true or not, but when I write my, I write my article for the bi-weekly issue, it's like, no, it's really not that science. It's because for the people who are from, different domains, I have to really take care of these things. And definitely that has brought about best in all of us. And yes, lastly, a big gratitude to Tanmoy and Himanshi again, for sometimes bearing with us, because yeah, since we are working from different time zones and yeah, busy in our own schedules, it's not always, we are matching with the time deadlines, although we try our best. So yeah, it has been a wonderful and fruitful experience working with, yeah, STEMPeers in newsletter.
Okay, I can continue from there on. Am I audible? Yeah, great. Okay, I'm Shalini and I'm one of the interns who is working with Himanshi. So I completed my PhD in human molecular genetics from JNCSR, and then I did a brief postdoc there. And after that, I wanted to really take a break to understand and analyze what I wanted to do further. And doing an internship in science writing was one of those. So there was an advertisement on STEMPeers for interns, and that's when I had applied for the internship, and I had actually really forgotten about it until Tonma's mail came in the end of May. And so it was very surprising, and I would say I was very elated to be a part of this internship, because I know that STEMPeers is a platform where there are people from different STEM backgrounds working in different parts of the world. Everyone brings in their piece of expertise. Everyone is an expert in their particular field. And additional to their main work, they're doing writing for Club Sci-Rai, or they are maintaining a newsletter. That is an additional work which they do. So that adds in a lot of different kind of experience which everyone has. And this has given an opportunity to interact with people with different kind of experiences, different kind of expertise, get to know what someone thinks about a topic. Like before each of the bi-weeklies, we decide on the topic, and then everyone makes different suggestions, and then we pick which one is the most comfortable one to go with, and everyone makes out different points which we can take forward as the different sections. And this keeps us all engaged, and of course using the WhatsApp platform has kept us all together, interactive and interacting throughout the time, and also getting to know through the STEMPeers platform that different people are also involved in other kinds of activities, like Nivedita's artwork, which we have been able to see on STEMPeers very recently, and which was excellent. And yeah, so it has been a very, very great experience so far, and I'm very excited to be a part of this group. I've learned a lot of things from Himanshi and Tanmay, the whole team, Nivedita, Kanika, Manish. Everyone has their own piece of contribution. Everyone has their own ideas. So when people from different experiences and backgrounds interact, it brings out the best. And of course, the cherry on the cake is when other people appreciate the work you do. So it's been a very, very great experience so far, and I would like to thank Himanshi for their constant support, guidance, and helping us through this entire process. Thanks.
So it's hi, I am Manish and not Pooja Chauhan. As it's shown in my window, it's my wife laptop, so that's why it's showing Pooja Chauhan. I'm a postdoc in Hebrew University of Jerusalem, Israel. I've joined Israel last week, and right now I'm in a quarantine. First of all, I would like to thank Himanshi and Tanmay for providing this wonderful opportunity to be a part of STEMPeer community. It's one of the largest community. I always want to be a part of such a scientific community that provide opportunity for the STEM careers. And from the very beginning, I'm always interested in scientific and medical writing. I never get such a good platform like STEMPeer newsletter, but before that, I used to write blogs for a non-scientific audience. But after getting this opportunity, I'm really very lucky to have such a nice platform to learn about the scientific writing and all those aspects. And I'm always grateful for the entire team like Nivedita, Kanika, Himanshi, and Tanmay. Thank you.
So just to continue, I guess we are done with the biweekly. So we can probably start with a bit of overview of the MedNess. I would actually not be the right person to give you an overview of MedNess because the load is being equally shared, or if I would like to put it, being taken much more by Nisha in coordinating the effort of everyone and putting that together, even the last minute changes that we always send it across. So maybe Nisha is the right person to give us an overview.
Yeah, like you rightly mentioned, Mayur, I think my job is coordinating. The real job is done by all my amazing team of content editors that do all the groundwork and get the stuff to me. Can I share my screen? Okay. Can you see something? Can you see something?
Yes.
Yeah. Okay. It doesn't let me. Sorry, I'm not that technological expert here. All right, so MedNess is a very niche newsletter that covers pharma news, including clinical trials, regulatory affairs, business news. Recently, we started doing reviews, looking at technology in healthcare and things like that. As I mentioned, I'm the person who coordinates efforts, and I've got an amazing team of content editors that take care of all these different bits of MedNess. So I'll tell you the story about how we grew as a team. And as we go around, I've got people from talking about their own feature, because I think the passion, you can see the passion from the people who write about it. So I've got people representing their own feature who can talk to you a little bit more about it. So MedNess started as Onco This Week and MedNess Plus on Club Sci-Rai. So these are our founding members. The ideas were from Ananda and Abhinav, who got Richa and Isha on board, and they used to write separately as Onco This Week and MedNess Plus for Club Sci-Rai. Then a year past that, they decided they wanted something like an email campaign to go out into people's inboxes, and also do more things like cover other therapy areas, cover other factors of news in the pharma world. So this team was born. That's when I came on board as the managing person. Richa was still working with the oncology heavy content, and Isha was writing about everything other than oncology. So if I can invite Richa to talk a little bit more about her feature now, and then go on to Isha, and then we'll go forward from here to the rest of the team. So Richa, are you there?
Yeah, hi. Thank you, Nisha. So
yeah, are you going to share something or?
Yeah, I'll share my screen.
Okay, so I'll stop sharing then.
Yeah.
Okay, has it stopped sharing now?
Is this visible?
Yes, yeah.
All right, so yeah, thank you for the quick introduction, Nisha. So as Nisha described that, I used to write like as Onco This Week. So even before how I started, so I had just transitioned from academia to industry. And I come only knowing, cancer signaling basics. I knew very little. And suddenly I come to industry where everybody is talking so much in terms of, drugs. They are talking about the PFS, the overall survival, the different rates. And I'm like, and they are talking about the drug names that I have never heard. I was so confused. I didn't know, where to start. And I spent like probably 1 or 2 months, and I realized it's not helping me. I didn't know how to, take down so much information. It was pretty overwhelming. What I did, I started looking at the news, and I started publishing it on my LinkedIn feed, which basically slowed me down. I was not just reading it, I was just taking it pretty slowly. I was taking it in, and it helped me consolidate that information. I think that was the time when Anando and Abhinav, they approached me and asked me if I would like to publish as a part of Club SciRai newsletter as like, Onco This Week. So we introduced this feature, Onco This Week, sometime in early 2018. I think it was March 2018. And I started publishing there. So as Nisha told that somewhere around mid 2019, Nisha and other people, they came on board and we transformed it as MedNess. So where we were including not only oncology, but everything other than oncology in one newsletter, which gets delivered to your inbox. That was USP, because earlier it was only the clicking thing and viewing it as part of what we were publishing. So as my first dilemma was what to include and what to exclude. Like there is so much of oncology news every week that it was very difficult for me. I knew my limitations. It was very difficult for me to cover everything. So I realized and I made sure that I only publish or only select the clinical news. There is a lot of preclinical research going on, but we can't cover probably everything. And because I was more interested in the clinical news, I went ahead with that. So everything was centered around the clinical trials. The second thing about geographies, I think, of course, like we cover everything happening in USA, everything happening in Europe, and some news from NMPA, something from Japan, and wherever we get. But yeah, I think we are kind of limited to the major geographies, like you can say the major, markets for drug makers. So the newsletter, we had like thought and rethought about what should be the structure, and the best structure I could come up with was that the newsletter that starts with drug approvals, because that is where the whole pharma and business, impacts the users the most. Any drugs that get approved, whether it is in USA or in EU, we cover here. We try to give a little information about like what is the drug, what is the patient setting, means which cancer they got approval in, what was the result, what was the clinical trial which led to this approval. Most of the times they are phase 3 clinical trials, but sometimes they are lower phases, phase 2 or phase 1. And then we try to ensure that we capture that information. The second part in the newsletter is like regulatory news, and anything to do with the regulatory agencies. If they are giving some designation like orphan drug designation to some company, if they are giving fast track designation, a breakthrough designation, or in case of EU, there is a prime designation granted to any drug, we cover here. All the updates about the submission, BMS filed BLA, or Merck filed SBLA, anything, NDA, SNDA, everything. So basically these submissions are different when the companies, they go to the regulatory authorities for submission and say, okay, we are ready. So this is the format that we want to submit our information towards the drug approval. We would cover everything in this section. And in addition to the regulatory guidance, in case like, some company goes to FDA and say, okay, then we finished our phase 2 and we want to see like how we can move ahead with the phase 3 trial. In that case, FDA may hold a EOP2 meeting, which stands for end of phase 2 meeting. What is covered in that meeting, what FDA tells them, how do they guide them about the phase 3 design, everything is covered in this section. The next section is trial results. And in my opinion, this is as important as drug approvals. So the trial results we cover mostly from the press releases that come from companies directly. And we capture all the trial failures. So now the trial results, companies are very happy when the trials are successful and they publish it nicely. What gets embedded somewhere, like between the lines is like trial failure. So we try to get that information and we try to publish it, where the companies might be slightly subtle about, reporting it. We are probably more transparent and we put it as a trial failure. Okay, so this big trial, this was going on in this particular cancer, and it was a pretty hype trial because there was a significant need in this indication. But yeah, this trial did not meet the primary or secondary endpoint, and we describe that. So these trial results, they can be interim results that might be coming or the final results. We publish everything. one source, like other than press releases directly from the companies that I use, are directly from conferences. And I know that it increases like Nisha's work, but yeah, we try for every major conference like AACR or ASCO or ASH or ESMO, I try to, capture like some 30 to 50 news, whatever I can. And we just put a list of that in our newsletter. And the next section is trial program statuses. The first thing that we cover here is enrollment update. Many companies, they like to tell when they have initiated a trial in collaboration with some company or on their own, in which indication it is, how they plan to move ahead. We cover all that. We also see if there are any clinical holds placed or lifted, because this is again very important. And what was the reason? And another big thing that really, is not much discussed, but we continuously cover is program discontinuation. Many times this program discontinuation, it's there in companies' annual or, those quarterly reports. They do not really talk about it other than that. But we try to bring it in the limelight, and we show that, yeah, okay, so this program was there and this is discontinued, or this is being deprioritized in the efforts of a portfolio prioritization by the company, and they want to invest elsewhere, invest their efforts and money elsewhere. The last section that we have is business news. In business news, we talk about mergers. Are there any two companies that got merged? Were there any acquisitions, like BMS acquired Celgene? That was the huge talk. That was probably the biggest pharma news last year, something like that. And then, are there any collaborations? These collaborations can be between two companies where they want to, try each of their molecule in a particular cancer type, or it can be between a company and an academic center telling, okay, so we are going to conduct this thing, this clinical trial at the center, some things like that. So I think, yeah, that's all we have here. So apart from there, like I already told, sometimes when we have conferences in those months, we have that last section where we talk about conference coverage. And yeah, I think that's the extent of it.
Thank you, Richa. That was a great overview. And thank you for the explanation as well. So people who aren't familiar with MedNess and the different sections, now they know what it means, including myself. So thank you for that. Over to Isha to talk about anything other than oncology. So she does a humongous job of covering anything other than oncology, which is a big, big task. And that's the reason she comes up every 2 weeks, because it obviously takes a lot of time to dig out all the information from the neuro, the respiratory, you name it. So, and she is also very good at ranking and telling beginners like me, okay, this is more important. Can you feature this as a highlight, please? So I'm very thankful for that, Isha. I wouldn't have been able to make that decision myself. So over to you. Tell us more about MedNess Plus and your very newest feature, the COVID special that's come up in 2020.
Sure. Thanks, Nisha, for the introduction. And thank you, Richa, for that detailed overview, because that's how I portray my section, everything else other than oncology. But whatever she said, I do most of it, not all, but it's actually pretty well divided. And whatever she showed is what we have in the MedNess Plus news section. So like Nisha mentioned and Tanmay mentioned before, that MedNess Plus was initially a part of Club SciRI. And the idea behind developing MedNess Plus was because Richa was already working on oncology, and we know that's like a huge area. We wanted to do something in, like I said, in everything else, consolidate the news and bring it across to readers. So that's how this whole initiative started. And the way I have my section designed is initially I do FDA approvals and rejections as the first section of my section, which is basically, I think that's really important to know because of so much information that's around. We need to know what's out there, what's available, what's available to people. So, and as important approvals are, I think it's equally important to know what's rejected, what's been taken off the market. So that was the idea between the first section. For me, the second section is clinical trials. So like Richa mentioned, it's mostly phase 3 clinical trials, but if there's something, groundbreaking, or if there's something that I think is going to be of importance later, I tend to put that in. It could be phase 2, phase 1, even. And the way I tend to cover it is I first give an overview of what the clinical trial or what the approval was. Then I try to have a section which is a little more generalized. For example, if it's an approval for a drug related to a particular disease, I try to incorporate what the disease is. I try to incorporate what it's targeting, what the mechanism of the drug is, because the problem when I started off is I'm an enzymologist. I've been that forever. So for me to understand clinical data or to understand diseases which I'd never heard of, it was difficult. So, and there's just so much out there. So I thought it would be a good way of representing what we have, so that anyone who reads it is able to understand the type of disease or the type of drugs that we're talking about. So I tend to be a little more descriptive than Richa's section, because I totally realize she's got this huge thing, and people are anyway more aware of different forms and different types of cancer than they are of a certain neurological symptom or neurological disorder that no one's really heard of. And it's not that common, but we would still like to educate and let people know what it is. So that way mine is a little more, it's a little different from Richa's section. And the third part of my usual MedNess Plus section is business models, but that's like a small real section because Mayur used to cover a lot of it. So I tend to just pick out the ones that are, which I think is more important. Again, it's just a small newsletter. We can't put in a lot of data or a lot of information, even though there exists a huge amount of information. It's present it's present online. So I just try and pick out the ones that I think are most important. So this is the general MedNess Plus section that I write, and it's a bi-weekly section. The new section or the new addition to this is the COVID special, and because it's a pandemic right now and it's seriously out of control in various parts of the world, and for the amount of information that's available, which is not true, I think it is our responsibility as scientists and researchers to bring out the ones that are. Make sure you tell people that not all medicines work. The ones that were thought to be working but have been taken off, stuff like that, which is not, it's out there, and then there's so much of misinformation. So I decided that that's one section I should probably put in separately, because it just highlights the present developments as far as vaccines are concerned, what are the different types of tests that are available. And I think FDA is playing a very big role in trying to accelerate the process of available tests to people. So this is the newest section of MedNess Plus. I hope I don't have to write it for too long and the pandemic goes away real soon, but this is an overview of my section. And thank you guys for being an amazing team. I think the biggest advantage of working with this team is it's very understanding, and we all have our daily jobs, and there are times when we are not able to finish up the work on time, and it's always been a very adjusting and understanding team. And thank you for the support.
Thank you so much, Isha. So, and I would actually also like to thank you for stepping up to the challenge of covering COVID-related news. You already had plenty when you were doing MedNess Plus, and then we told you, no, we want a COVID special. And she never said no. She was like, Oh yeah, I will do it. And from next week on, I had a separated section of COVID Special and MedNess Plus. So
I know,
yeah.
and we should actually thank you for the amount of information that you consolidate and put together, because I know Richard and my sections are anyway very huge. To go through it and make sure that it comes out right the way we want to is a big job. So thank you for that.
Thank you guys. So yeah, so if I can share my screen again, because I like to show pretty faces. So all right, can you guys see it? So this was the team till 2019 December. And then there was this idea that, okay, we are doing clinical trials, we're doing approvals, we're doing failed trials, we're doing business news. We need something more. And that's when we had volunteers. So we always had interest about from people to join in. We just didn't know where to place them. And then people started coming up with ideas that, okay, I will write about this. And then we couldn't say no. So that was the team 2020. So we had Tanmay and Arundhati come forward and say we'll do reviews. So Arundhati started on another section that she will talk about. She's on the line. Then we had Divyanka because she is looking for a transition and she wanted to get to know more about biopharma business. So Mayur was her mentor and they've done a fab job. And now Divyanka has taken over and Mayur is in a senior position, we can say, as a consulting editor. And then we had Debarati who came forward and said, okay, I can talk about technology in healthcare. And that was something, A, we never thought about it. And second, we thought it was super cool. So we're like, okay, you have sold your idea. You have a feature for yourself. And because it's difficult and there's not much technological advances happening on a weekly basis, she does a bi-weekly section with a biopharma news as well. Divyanka does a bi-weekly session and Arundhati and Tanmay alternate. So we have a review every week. So over to you, Arundhati, to talk a little bit more about the review section in a little bit more detail. So do you have anything to share, Arundhati?
Yeah, sure. Thank you, Nisha.
Sorry, Arundhati, before we go on there, we have another 10 minutes because at 4 o'clock, there's another meeting starting via the STEMPeers. So we might have to condense this. Sorry.
Okay. Yeah, I'll make it short.
Sorry, Arundhati.
Thank you.
That's fine. Yeah, go ahead, Tanmay.
Yeah, just Ishani is also there from the editor's choice. So just to give her a couple of minutes before we wrap up. Yeah.
I'll start because I literally got the link at 9. Thanks, Tanmay, for this.
Yeah, just let's let Arundhati finish. Then you can wrap up.
Okay.
Okay, great. So I've been writing for MedNess since like around this time, 2019, and when I reached out to the team, the initial idea I proposed was having these short interviews with startup founders. We called it iCube for ideate, innovate, and incubate, and basically get the experiences of startup founders and consolidate as an interview kind of section. We did cover one startup, but unfortunately, we didn't get a lot of. I didn't have a lot of time to reach out, and we're not getting a lot of responses from the startup founders because they're very busy. So we had to archive that section. But that being said, Nisha, correct me if I'm wrong. We would be really happy if someone could take that forward. And and I also joined a new role, so I didn't have a lot of time to devote towards that. So I started writing for MedNess Reviews. So MedNess Reviews is basically, we have a lot of freedom to write on any news that is interesting. There's no specific kind of topic, but what we generally focus on is kind of interesting research coming out of universities or any regulatory approval. So basically, there's a lot of freedom. And this section is evolving. So we're still trying to figure out, what would be the best, a kind of path forward for this section. Tanmay can maybe say more about what he writes about as well, to give the readers an idea.
I think I'll not take more time, but I agree to what Arundhati said, that it's an evolving section, and I have also joined, I don't know, 2-3 months back now. And I really enjoy working with the team because, as others also said, Isha and Richa, that it's a very forgiving team. Also, even if the things reach like at 11 in the night, Nisha is happy to get things done the next morning, and things run very, very cooperatively, how it should. And very happy to be also part of this team.
Thank you, Tanmay and Arundhati. That was a good overview. So I will only take like 2-3 minutes to talk about numbers and things like that. So come on. All right, so the features, most of the features have been covered by our team members. Health IT, we don't have Devrati on the line to talk about it. But like I said, it's technology in healthcare. Reviews so far, we're talking about recent papers and some technological advances, but we are open to ideas. So any new intern that comes with a good idea, we are very happy to have you on board. In terms of how we are growing, as you can see, we are only growing. It's not going down. So we've had on an average 3 new subscribers per issue. We've published 60 so far, and we are 172 today. Among the nonprofit organizations, we have a 15. We are pretty on the top in the newsletters that come out of nonprofit organizations, and we have a 15% open rate, which means at least 15% of our subscribers are opening the email, are clicking on the link, and going through the headlines. That's all we can ask for, because everybody has a busy life. Looking at demographic, we have a very female-oriented subscriber list. So...
Sorry, Nisha, I'm interrupting you here, but I had something very heartening. So I had an interview last week, and I asked my friends, the people who are still working in oncology, like day in, day out, and I asked them, which is the best source for me to, just look at all oncology news. And they're like, MedNess. And it was a very proud moment for me.
I mean, we all have our positive experiences with MedNess, with our managers recognizing it on LinkedIn and things like that. So but I didn't want to take too much time for that. That's why I'm not talking about all those stories. Yeah, so like I said, we are a very, our subscribers are mostly female, so girl power. Most of them are from India and USA. So Europe and UK needs to buck up. Come on, guys. And all right, so going forward for future direction, as in short-term goals, we obviously want to grow in numbers in our team and in our subscribers. We are looking to introduce an educational feature. So like you notice, like Isha comes from a place where she wanted to learn more, and she started collating and started teaching herself, and now she has a feature. Richa comes from the same place, academia to industry. She wanted to teach herself. And so these people have done the groundwork, and they are in some good place in their careers. So we would like them now to educate, and lend a helping hand to people transitioning, to help them cross the bridge, which is the motto behind STEMPeers, if you like. And there are many more. So I have a team of 10 people, so team of 10 bright minds who keep churning out ideas, and it's a tough task to say, okay, this can't work, and this can work, and this can work, and this can work. So anybody who comes on team is really welcome to come up with ideas, and anything that is viable, we obviously take it on board. We have openings for aspiring writers. Like I said, I need somebody to take care of the social media and putting the newsletter together if you want to do 2 issues in a week. So anybody who is into learning new softwares, working with LinkedIn, Twitter, please hit us up. We're looking for designers for our logo. We would like to evolve MedNess as an independent platform. So as we are looking for designers for our newsletter, for a logo, for a website and things like that. So any creative minds in STEMPeers who would like to give it a go, hit us up. That's our email ID there. We'd like to thank our sponsors who keep us going, and obviously my amazing team that is so committed and on time. I mean, they say that they come at 11 o'clock, but at least they come on a Monday evening. So I'm just happy that they don't come Tuesday morning and tell me in 2 hours, please churn out a newsletter. So Thank you, guys. You're doing a great job and keep doing it. Now I will let Editor's Choice talk. So that's it from MedNess. Thank you.
Yeah, thank you, Nisha. Maybe now we quickly move to Ishani. She has been working with Saurav and Priyanka for the Editor's Choice, and she'll give us an overview. And thank you, Shivani, for joining us last minute.
Oh, Ishani. Yeah, hi, I'm Ishani. So that's fine. So I'm part of the Editor's Choice weekly updates. So what we do here, so this is a relatively new platform, and we started in May, and Saurav came up with this idea. And so we are a group of 15 people, and we are divided into two groups. So one group posts in 1 week, and the next group takes over the next week. So what we do is we try to bring the latest updates from diverse areas of science and technology. And so this group is quite diverse because we do not really focus only on life sciences. We have people from other areas like physics and chemistry as well. So yeah, it's a pretty diverse background. And since we do not have, like, a lot of us do not have time to go through long articles, so this weekly updates, actually we post blurbs of interesting articles which we come across. Yeah. So far, I mean, yeah, we started in May. So far it has been interesting and fun to work with, and it doesn't take a lot of time because we are just posting blurbs of the articles which we find are interesting. So yeah, it's a quick way to, just if you're curious, if you're interested in something, you can just browse through it quickly and know the summary of the article which we are posting. Yeah.
Thank you, Ishani. Maybe just as a last word, I would like to say people here have presented themselves of what they have been passionate about and interested in. But if you think you're interested, this could be one of the leads where you can take your foot forward and then plan your career in future, because this is something that has happened to me, and I'm sure this is something that has happened to most of us here. So if you think it could be an interesting option, do write to us and we'll get back to you. Thank you.
Thanks.
Thank you, everybody.
Thank you, everybody.
Bye-bye.
Bye.